over the next 4 hours. Well, poverty, the COVID-19 pandemic is having a marked effect on workers in developing countries, where 7 out of 10 of them make a living through informal markets. Many of them simply cannot earn a livelihood if they cannot leave their homes due to the lockdown. Now, the United Nations Development Programme has estimated that the introduction of a temporary basic income for about 2.7 billion people living below or just above the poverty line can halt the COVID-19 surge in an era when half of the world lacks social protection and healthcare. And to bring this issue closer to home, we're joined via Skype by Dr Aradhana Ramnund Mansingh, an academic at MANCOSA and former human resources executive. Doctor, pleasure having you on the program.
Thank you. Great to be here this morning.
All right, so poverty among South Africans, key issue, especially when you put it under the umbrella of COVID-19. What's your take in terms of how it has affected South Africa in terms of the poverty line?
Look, before COVID's hit, we are a country obviously still reeling from the structures and processes caused by apartheid. So we still, getting into a state of equality or moving along those lines. Now, something like COVID-19 has, obviously exacerbated that very, very quickly. So we've got over half our population that are living in poverty, and we already started from a baseline where these were the statistics.
Right.
There's not much statistics post January 2020, which cites it at 30 million. So it's obviously significantly higher at this point in time, obviously with the job losses and the state of the economy due to COVID-19.
Yeah. I want to give our viewers some context here, and I think it's important to start at the beginning. Let's take 2 steps back and give us the definition of poverty. How is poverty being defined now?
There's and this is the issue or area of contention. Because it's people who are really just struggling to survive, to put food on their table. It's about women who are choosing or having to be forced to go and collect a daily sum of water around the world rather than go to school or to be educated. So it's not about defining it in one area or one space. It's about lived experiences of people who are actually just struggling to survive on a day-to-day, hour-to-hour basis, trying to keep their families above water.
Right, and it's not just about the money you have, isn't it? It's a multi-dimensional issue when we talk here about poverty, and especially when we talk here about women and how they are disproportionately affected by poverty. And we're talking about issues such as dangerous working conditions, unsafe housing. The United Nations says a lack of nutritious food, etc., etc.
And in South Africa, I don't think we've taken cognizance of the fact that of the poverty statistics, 52% of these people are female-headed households. So yes, women do face higher and greater challenges in poverty-stricken areas. And we have all these wonderful programs that over the years come into play. International, the small grants program, we have the local stockfels.
Yeah.
But and the point or the program I want to comment on is a program like the EPWP, national program to deal with poverty alleviation. Now, the target that the EPWP started was 55% of women would be employed on the program.
Right.
Which is a great, and this is why I say we've got wonderful programs, beautifully articulated on paper, But when it comes to the actual monitoring and evaluation that these programs are actually addressing the needs that it's supposed to, herein lies the problem. Because, with the EPWP, the 55% should be addressed. In addition, the latest stats is just over 4 million people have been employed. Now, how does that compare to the over 30 million people in the country that are living in poverty?
So what are you saying?
So it's great.
Are you saying not enough political will to get us over that line?
There isn't. A lot more needs to be done. We have those processes or programs in place as a first step, but these programs are not being correctly evaluated. If we say 55% of women should be employed, that is obviously aligned to the fact that there are more women households that are living in poverty in the country. But no one is actually monitoring these stats. And as a second point, the country doesn't seem to be doing enough in terms of, I was listening to the president, who's done a phenomenal job in supporting the country during this global pandemic. However, the 600,000 jobs allocated to labor, there's I think 40,000 with the teaching. There's groups of jobs that he's making available to assist the country during COVID times. But what about the long term? No one's talking about the long term. What happens to the in excess of 30 million people who are living in poverty?
What about the discussions around the basic income grant has been used as a bit of a buffer to help the situation? You think this is a good idea?
Look, it's always a good idea, additional income. But we need, when we look at the lived experience of a lot of the families living in poverty, we need to take cognizance, and it's often overlooked. We need to take cognizance of the fact that when lockdown started and we started getting these grants, yes, the extension of the grant is going to help feed families. But when we started this process of lockdown and, trying to get the numbers of COVID down, we had a large number of university students, funded students, who had to return home. We had a large number of family members who worked in other provinces, and most especially domestic help, who would have to return home, putting a strain on that household economy. Or household budget. And in addition to that, this is a household budget that was accustomed to getting this external income from the people that are working outside of the province or outside of the home. So, COVID has put a huge strain on these families and households. So the extension of that grant is incredible. But we also, in addition, need to take cognizance of the fact that there are a number of people, specifically men and children or older children, who are using this additional money for alcohol and drug abuse. While their immediate families go wanting. So these are the both sides of the coin that we need to actually take into consideration.
Issues like that, also issues of the healthcare system as well, unequal access to the healthcare system. And here I'm talking internationally as well. This is the issue with regards to poverty. Access to the justice system as well. All contributes to what we're talking about in terms of the eradication of poverty. Doctor, we appreciate your perspective. We no doubt we'll have you back on the program to get your take as to this plan, this economic recovery plan, and what it's doing to the economy and how to eradicate poverty. It's a very, very important topic to discuss, and we appreciate your insight. Be well.
Thank you. Thanks for having me.
All right, that was Dr. Aradhana Ramnund Mansingh, an academic at MANCOSA and former human resources executive there, giving us her perspective. Eradication of poverty, much in the spotlight today. We want to discuss this in the various aspects. How is poverty defined in your community? You can let us know at the agenda _SABC. I want to take